without care.
All right, 6:15 right now. State health officials suspected a 5-year-old girl in Durham died from bacterial meningitis, but yesterday we found out that was not the case. The test came back negative for the bacteria. The child attended Mount Zion Christian Academy. More than a dozen other students received medicine as a precaution, but there have already been 6 cases of meningitis reported in North Carolina so far this year. So what are the signs and what should we be looking out for? Our health expert, Dr. Kevin Campbell, here this morning with more. Doc, good to see you.
Good to see you, Phil.
What is meningitis?
So meningitis is inflammation or infection of the lining around the brain and spinal cord. It can be a deadly problem and takes many lives every year.
Big difference between bacterial and viral, correct?
There is. A viral meningitis is much more common. We see it during the summertime. Typically doesn't require antibiotics. Rarely is deadly. However, bacterial meningitis can be absolutely deadly within hours. So it's very important to understand the signs and symptoms and get to the emergency room if you suspect it.
And we were talking before we came on here. I had bacterial meningitis as a child. I remember severe headaches. Is that one of the symptoms?
That is one of the symptoms. You'll have a stiff neck where you can't put your chin to your chest. You may have high fever, chills. You may have poor appetite. In an infant, it may just be very nonspecific, like irritability, inability to sleep, trouble feeding. So you really have to be suspicious if your child or if yourself has some of these type symptoms.
I also remember going to the hospital and a lot of spinal taps. Is that how it's mostly treated? And
so in the emergency room, if we suspect meningitis, the first thing we're going to do is give you antibiotics right away, and then we're going to prep you and actually do a lumbar puncture or spinal tap. Because if we can look at that spinal fluid under a microscope, we can determine whether it's meningitis from bacteria or virus or just inflammation of the lining and treat you appropriately. But honestly, the important thing is that your doctor gives you antibiotics immediately, either intramuscularly or IV, until we figure out what it is.
Stay on top of it. Now, in this case, luckily, well, it turns out that this girl did not die from meningitis. We don't know what she died from at this point. That's still under investigation.
That's right.
But what should parents out there be aware of? What should they be looking out for with their children?
You need to understand that meningitis is spread by contact with mucosal surfaces. In other words, sharing forks and knives, sharing glasses, sneezing. It can be aerosolized in that way.
Right.
And if you have a child with a stiff neck or fever or feeling poorly, you need to get that child seen very quickly, especially because this can be deadly in 2 hours or less.
No doubt about that. Very serious case. All right, Dr. Campbell, always good to see you,
sir.
You,
Phil. Thank you.
And of course, if you have a question for Dr. Campbell, really easy to ask him. Log on to our website, WNCN.com. Search links we mentioned. From there, you can find Dr. Campbell's website, or you can like his Facebook page, and you can hit him up on Twitter.